just want to offer up that we're holding a lot of families and friends in our hearts as we're all watching the flooding in Skagit County and Whatcom County unfold. We're hoping that today we would be able to take a little bit more of a deep breath, and it still feels like we're holding our breath. So hoping today is a little bit of respite and some inspiration on what is quite timely around othering and belonging, and really this sense of belonging and civic muscle is really at the core of taking care of each other. And I think that really speaks true to what's happening. You're seeing stories of the community showing up, picking neighbors up in boats and tractors, and then asking how we can help. So hoping today provides some inspiration and some nice storytelling. We've got some great speakers today. Belonging and civic muscle is part of kind of our learning series that we've been doing throughout the year on the vital conditions. And I'm really pleased that we're ending our last one with this topic because I think it both really timing. It aligns with what many of you have been seeing of like where the ACH is headed next year around our kind of collaborative action network. At the core, a lot of the work is within this topic. So I'm really pleased that today is what we're going over. I do want to just offer prayers to the family of Jose Garcia of Everson, who family is still waiting on word. Jose was swept away by the floodwaters, and so just want to hold space for that family and that our prayers are with them. So Monty, I'll hand it back over to you, and we'll kind of talk about belonging and civic muscle and how timely it is for today. Thanks.
Yeah, thank you, Nicole, and thanks for kind of setting the stage and reminding us kind of what's really current for folks. And again, I offer our condolences and sorry that you all are having to go through this again as a community or at this time, and also praying for safety and a speedy recovery. And glad that you're here. And I agree with you, Nicole, that it's kind of a timely vital condition. And so as always, we're really anchoring this work and thriving together approach, which, as Nicole mentioned, is really informing a lot of the way that you all are starting to think about how to work together and prioritize work through the post-Medicaid transformation world. And belonging civic muscle is the vital condition we're going to go deeper on today. And as we've done before, is to take these broader ideas and then really kind of anchor them in real stories, real experiences. And so we have somebody from outside of your community, Tatiana Maida from Milwaukee in Wisconsin, who is going to share a little bit around resident engagement and how they're approaching civic muscle and belonging. She's with the Share Collaborative, and she's actually also just joined the Community Initiatives Network, which we're delighted to have her on our team too. And then we're going to pivot and hear a little bit from Rachel Lucy and also Melissa Bird, who are working through a really interesting partnership through Peacehealth and how they're approaching this idea of belonging and civic muscle. And then finally, Marco Morales, who's going to tell a really, I think, fascinating, offer kind of a story that's in motion around in Mount Vernon. So all of that's going to culminate into a little bit of a dialogue that Heather McGinnis is going to help support, and your opportunity for you not to only kind of be in dialogue with some of the folks that have presented, but also for you all to chat or offer up questions or ideas yourself. So that's the game plan. And I'll maybe just remind folks a little bit around this thriving approach very quickly. And so the larger kind of framework or approach is really understanding that we need to root our current realities and understanding the legacies of our ancestors, of what has preceded us. And you all do such a nice job. I think the land acknowledgement is obviously kind of a nod to that, but just recognizing the long legacies of exclusion and trauma, but also the legacies of resilience and hope that have come along with that, and how we really understand and situate people in place through the understanding of past legacies and their impact on today. And then really understanding the vital conditions that all human beings, no matter where they are in the globe, need in order to thrive, in order to kind of live their best possible lives. So this vital condition framework offers a way of some shared thinking and, of course, shared stewardship, what you all have been doing, and I think are really leaning into as you move into the future, is how do we work across differences to ensure that everybody has the vital conditions they need to thrive, and how do we create new legacies of well-being and justice? And you all are well underway in that work. Next slide, please. So as Nicole had mentioned, these again is just kind of naming those vital conditions, and as this depicts, the at the middle of that is belonging civic muscle. It is a vital condition, but it's also what gives energy to, and it's what animates all these other vital conditions. I know you all have done a lot of work around belonging and have been thinking a lot about belonging, partly through your work with the Other and Belonging Institute, and this idea that we are wired to connect with each other. We all have a need to belong, and it is vital to our ability to thrive. And I think there's a next slide on this that kind of links this idea of what we all individually need, the social connection and support that is playing out even this week in deeper ways as you respond to adversity. And our ability to belong. I love how John Powell talks about belonging is not just inclusion, but it's a co-creation process. So this kind of virtuous cycle: when we belong, we have opportunities to contribute. We have a chance to co-create the types of conditions that we want for all people and places in our region, in this case, the North Sound. So this is a broad idea, and there's no one right way of doing it, which is why I'm really excited to kind of, each community discovers their own formula around how they build belonging and how they build up that civic muscle, the ability to kind of work together across differences. And so to kick us off and hearing a little bit around what that looks like in another part of the country, I'm going to invite Tatiana to kind of share a little bit about your story and what you're learning in Milwaukee. Tatiana, are you on mute right now?
I am muted. Hello. Good morning, everyone. I'm Tatiana Maida. Thanks, Monty, for the introduction. Today, I'm going to be sharing a story of belonging from a community that was told that they don't belong, and how their individual and collective power and resilience really helped them to transform themselves and the community where they live. I also would be talking about my experience working for over a decade in community engagement for a federally qualified health center in Milwaukee, Wisconsin. What I've seen from working with people on the ground, and from working with organizations and institutions that are really trying to lead equity work, but perhaps are not having some of the tools or some of the understanding of how to do that work more effectively. So I will share that, and hopefully this story can connect with so many stories that are happening in the country like this, like in the places where you are at, and we can find some common ground. So I'm going to share some slides. Okay, so I will start with this one. I like this quote: "Home is not where you are from, it's where you belong." Here you have these two ladies. They are Marisela and Marta. They are both from Mexico, and they have been living in Milwaukee since early 2000s. And they formed their families in that place. And I think about in 2010, they joined this program that was doing family education because they wanted to learn how to eat better, how to feed their families better, because there was obesity and diabetes in their families. They were very shy and quiet at the beginning. They just wanted to learn the basics, but soon they started to think and question things like why we don't have enough healthy food in the neighborhood. How can we exercise if the parks and the streets are not safe? There's reckless driving. The parks are not safe places. So they started to question that, and it's around that moment when they were invited along with other people to join a program that just started. It was supposed to be a community leadership program. So they joined the program, and the program was later called, and they picked the name, the group picked the name, was called Latinos por la Salud or Latinos for Health. And they came up, they did a visioning process and all that, and they came up with this mission statement, which was like they wanted to create and maintain a healthy community, expanding education and advocating for access to healthy food and safe physical activity. So it was men and women really embarking into this dream, like what can we do? And that was one of the questions that we asked them, what do you want to do? How can we support you? What changes you want to do in the neighborhood? And Marta, one of them, she said, well, we cannot make that decision because it's just a few of us in this room. We need to go out there and ask the people outside in the community what they want, what are the priorities. And that's how the first community health assessment was born. They learned how to come up with their questions. They put together a survey. They interview over 300 people on the streets. They learn about data entry and how to analyze the data. And after that, they came up with a set of priorities. What was first, what was second, and all that. So that was a process. And so basically that program, what they did, it involved community leadership development, what they need at what moment so they can keep doing the work that they wanted to do. They did different community assessments. They did walkability assessments, bikeability assessments, parks assessments, because they really want to understand how the streets were. They learned how to understand what the built environment means, and by walking over 500 streets and intersections. And obviously they had to, and based on those assessments and the results of those assessments, they came up with projects. And to implement those projects, they needed partners. So they learned how to partner with organizations, institutions, or support whatever projects those institutions were doing if they would align with what they wanted, what the group wanted. I'm just gonna go quickly through some of the things that they did. The first project was the Healthy Grocery Store campaign. They work with 2 main grocery stores because they wanted a dozen of healthy items to be included on the shelves because they weren't available. And in exchange, they'd let kind of food demonstrations with customers so people will buy the ingredients. So we will be kind of a win-win for the store, but also for the community. They learned about nutrition, and so they became health promoters and led tons of peer-to-peer education from their own perspective as parents that are struggling with healthy eating and with kids not eating vegetables and all that. So they were the best teachers because they were talking from their own experience. They did that in schools, in different community events. They did lots of education. They opened different walking, biking, and exercise clubs in the neighborhood, open for the families. They organized this event that became the largest event in the neighborhood. It will gather up over 1,000 people. It was an annual event. They did it for about 4 years, where it was really how to make biking a safe thing on those streets. For that, they had to partner with several organizations, I think a couple dozens of organizations from bike shops and others to get donations from bikes, give away helmets, healthy food, and all that. And finally, they touch a little bit in policy. They work with one school to implement the first food policy of that school. It was a very participatory process to see what things shouldn't be in the menu and what things should be added. And also supported a coalition that was working around complete streets. And they really were instrumental opening different community meetings where they will talk to other residents about what was complete streets, why was that important, and get signatures. I think they gathered about 700 signatures from residents. And that was important because that was one of the things that helped for that policy to pass in Milwaukee in 2018. So that's some of the work that they did over the years. Here is again Marta and Maricel after some of the journey. In the picture in the left, Marta is with the mayor of the city. She earned a recognition as the neighbor of the year or something, one award. And Maricela also got different awards from local organizations. None of them are in the group right now. They both kind of took off. They started their own personal journey. Right now, Maricela, when she started this, she was in 5th grade. And later, over the years, she got a GED, she got into a technical school, and now she works for UW Milwaukee for cooperative extension as a formal health educator. So, and she told me, I spoke with her last year, and she told me, Tatiana, if something I've learned is that just the sky is the limit for me. I can do anything I want to do. So that was, I'm gonna stop sharing my screen. So this is, I mean, in a way, this is obviously a story of successful grassroots work. People really organized and they did a lot of work. But at the same time, I want to talk about the struggles of that, because it's not that easy. It was really hard. It is a really hard work. Latino groups, as well as many other communities of color, they have to struggle with this sense of not belonging, to hearing this message, you don't belong here, you shouldn't be here. And that's something that they internalize in many ways. And that impacts the way how they are, and who they can become, and all what they can do for themselves and their communities. So that was the situation here. There are so many challenges that they face. I showed the nice pictures, but there's so much behind that had to happen in order to have those projects moving forward. Some of the challenges are, in this case, are language challenges, because most of them are Spanish speakers only. So there's cultural challenges, there's educational challenges, not knowing how to understand what is happening in meetings, what they are understanding the narrative, understanding what built environment is, even if they know in their own words what a built environment is, but they won't understand in the context of a regular city meeting, for example. So there's so many challenges. So they cannot communicate or understand those that are making decisions on their behalf. There's also challenges regarding time and transportation, how they can attend to meetings, to trainings, to different projects while they are balancing with their kids and maybe work. But I think the biggest challenge for communities in general and for residents is the lack of recognition and value that they receive from organizations or institutions. And I have to say this, that I think all over the country, those of us that are doing this work, we truly believe in equity and we want to do that work. So there's the big and the honest intentions there. At the same time, there's something that is not clicking. In some cases, and this goes in different levels. Some organizations obviously are doing more effective and intentional work than others. So it can vary, but what we've seen and what I've experienced and they have experienced is that many of the organizations they were working with, they would like to use them to, okay, can you do this for us because you are on the ground, and we will give you a $20 gift card, maybe, if so, or just a thank you note. So there's not a true value of who they are and what they bring to the table. And some of this is unconscious, it's not intentional. And that's something that we've seen over and over. And the other thing is that this lack of recognition of what they can bring happens also in the residents. It's not just from the outside. They also have internalized so much of this that they don't feel like they can offer anything. They don't recognize all the power, the wisdom, that their lived experience brings. So that it's kind of a cycle that is reinforcing constantly, and it's not helpful for the true equity work that we all want, right? So I guess for me, working in this field has been like some questions that come to me, like what can be done to keep moving this work forward in more effective way, and what kind of reflections we need to do, those of us that are working with organizations and we truly want to do a better work engaging. And so to me, it's like, for example, how do we see the communities we serve? How we truly see them? We don't want to have a paternalistic approach, but maybe subconsciously that's what we end up doing. Do we recognize, or do I recognize some implicit biases that I might have with the communities I'm serving? And if I do, how those biases might be impacting the way how I engage with them, and the way how I involve them. Do I see them as, do I really recognize what they bring? Or it stays more in the superficial talk? Do I really recognize? Do I see them as equal partners? Am I able to trust them enough for them to lead something sometimes? Or what do I need to trust them more? Or what do they need to increase their capacity to do better job, you know? And I guess what the biggest issue also is investment. How much we invest in terms of money, time, capacity, in a way, are we investing in the same way that we invest with the traditional partners to build those relationships and those levels of trust that are needed? So those, I guess, are some of the questions that I think still need to happen in a deeper level across organizations. Again, I'm not generalizing, every organization is different, but I think some of these conversations need to happen a little bit more when there's true interested to do a respectful engagement with communities. It is really essential. And also, I think this, as a summary, this is a story of belonging, because in a way, these members that at the beginning didn't feel like they belong to the neighborhood, they felt like they just live on the neighborhood. Now that neighborhood has changed, has shifted completely. And they know that they don't just live there, they belong to that place. And they learn that thanks to the work that they learn how to do, the connections they develop, all that happens. So it's definitely a story of belonging and civic muscle, because they really work around that. But also, to me, it's like, as much as these communities need to keep developing that civic muscle, how we are in the other side can increase our reflection, and in terms of humility also. Who am I? What I'm bringing here? Am I what I'm not bringing? Being humble enough to recognize that I don't have it all, and they have other aspects. So, in one way, they might need to keep developing the civic muscle, but also comes this word to me, how we develop our humility muscle as well, those of us that are in this other side. So again, I hope this story can bring some of the connection. There's a lot of more work that needs to happen in order to engage in a respectful way, in a way that respects the different identities of people. Because otherwise, people are gonna keep feeling marginalized, and that's not what we want. And we might be still doing that subconsciously. Thank you. So I don't know if there's any time for questions, but I would leave it there now.
So Tatiana, definitely there'll be some chance, and I see even some ideas in the chat that have been sparked. And just again, want to thank you for kicking us off with that story. And I really appreciate the pivot from these great photos that we see, and to forget the stories behind that. As you and I were kind of talking, I think last week, just this idea that sometimes our ideas of engagement can be pretty anemic, a little bit of input here or there, and underneath that are some stories, some bias, some narrative around who's capable and who's really valued. And so appreciate you kind of reminding us of this virtuous cycle between really belonging and moving into folks owning and feel like they're belonging through actually taking action collectively in their community. So more to come, but thank you so much. And on that note, I'd love to kind of turn to some local example. Rachel, I think you were going to kind of kick us off with a little bit of work you're doing through Peacehealth.
Yeah. And as I'm getting started, if I could, Melissa's going to be joining me. And Melissa, if you can just say hello, just so we know your audio is working and don't have to troubleshoot that.
Hello, everyone. Can you hear me?
We can hear you and we can see you. Thanks, Melissa. So I'm Rachel Lucy. Thank you, Monty and Tatiana. That was incredible. I work here at Peacehealth in Whatcom, Skagit, and San Juan communities as our Director of Community Health. And a lot of my work really focuses on exactly what Tatiana was mentioning around that engagement with community. But part of that also involves the engagement with our own workforce. And so I want to touch a little today on how belonging and civic muscle is really rooted in our organizational values, and also share with you an example, and then let Melissa share a little more about how that's resonated with her. I love what you said, Tatiana, about working with organizations who are passionate about health equity, but need those tools to get started. And I think that describes so well where we started out as a healthcare system not that many years ago. And while we don't intend to have a parental relationship with community, I know that's so often what happens. And so those questions you were asking us to reflect on around how do we truly see the communities we serve and how are we trustworthy partners were two of the really guiding reflections that led us to the story that we're going to share today. So two things I would just mention as a starting place are one of four of our organizational core values is social justice, which we define as building and evaluating the structures of our organization and those of society to promote the just distribution of healthcare resources. I've been sharing that core value with new employees for something like 20 years in our organization. It's so rooted, justice is so rooted in who we are as an organization. And continually exploring what that means is a really big, important part of our formation. It's also peace through justice is also the charism of our founders, the Sisters of St. Joseph of Peace. And we are still learning from them today in this year 2021. And then I wanted to mention also, some of you may know Clint Smith. A number of us had the opportunity to see him speak live in 2019. He's a poet, a teacher, a writer, a Harvard University PhD, and just incredible. And he urged us to consider the work we do as not as works of charity, but as works of justice. And this resonated with us in so many ways. I remember one of the things he shared when we saw him was charity asks, how do we feed the hungry? While justice asks, why are there so many hungry people in the first place? This led us to have different conversations about the work we do in community benefit, starting with our board, our leadership of the organization, and then eventually, as Melissa and I are going to share, really engaging our employees in that same reflection. We set out to find ways to spread this important message and then start shifting the mindset from charity to justice. This is a really important part of the journey that we're on. Around that same time, our Nursing Professional Development Council, made up of frontline nurses, approached our community health team and said they wanted to plan a conference solely on connecting our healthcare workers with community organizations to look at how are we addressing upstream social and political determinants of health. And of course, not surprising, the conference was set for May 2020, and as you all know, what was happening at that same time. So it was postponed, but those nurses, as soon as they had the space to plan, went on to develop a 6-session virtual continuing education series to accomplish this goal they had. Over 500 healthcare workers enrolled, many of which were from Peacehealth. But this was also open to our communities with the help of North Sound ACH. And so we had people participating from local FQHCs, public health team members, even some of our nursing home administrators we would see from time to time on the calls. So a real diversity of people in the healthcare workforce who wanted to engage and to hear these learnings. Each session was presented by a local nonprofit leader with knowledge of the community landscape. And each session focused on a health-related issue while also introducing our workers to the ways they can advocate for health equity. So a real focus on that, building civic muscle. The very first session we had was set the tone for all the future sessions. We had national speaker and emergency medicine physician, Dr. Yushi Blackstock, who presented on the historical roots of racial inequities in medicine and how those are sustained in our very systems and structures today. So again, we asked every presenter that follows, please watch the opening keynote and integrate that foundation into everything you share with our employees, because this is where we start. This is how we build our awareness and then take different action. So often, and especially in our hospital setting, we only get to see an instant in time of someone's life. And this series really helped our caregivers to reflect on all the possible contributing factors impacting health, especially the unjust factors. A whole lot of what we learned in these sessions is what Tatiana was describing around how we have respectful engagement with community. and individuals within our community. In fact, so many of our presenters, like Melissa, who is one of our presenters, they shared that real community-based work and what they've learned over the years, everything from trauma-informed care to lessons on poverty and working with communities experiencing poverty. So it's pretty incredible. So today I asked Melissa to come share. She was one of our presenters from the health and housing session that we had, along with Emily O'Connor from Lydia Place. And when I first met Melissa, some of you will get a kick out of this story. She was a nurse here at Peacehealth. She still is a nurse here at Peacehealth. We met in the cafeteria of the hospital, and she brought along a brochure. I think you had just drafted at home for a nonprofit that you wanted to create. And I wanted to hear all about it. Fast forward, I don't even think it's been 2 years. Melissa is the president of Road to Home, a nonprofit locally that started up, and they just opened their first tiny home village on Lakeway Drive here in Bellingham, and have 17 residents who are now sheltered, many who are medically fragile. And I love this picture of Melissa. This is Melissa with the governor last month, and just shows the incredible potential that our healthcare workers can have when they have the space to contemplate these really big issues. So welcome, Melissa. And if you can talk a little bit more about your journey, that would be wonderful.
Hi, thank you all for having me. So for me, the health equity series that Rachel and her team put on really bridged the gap between clinicians and social service providers, which I found super powerful. Kudos to your team for finding a lot of people who work within healthcare, work within the system, in the hospital or outpatient, that also work in social service agencies. So I felt we were able to share the lens, both sides of that. We understand the constraints of the healthcare system and the constraints of the social service system. And so you can kind of look at the barriers from both sides. I, of course, was very fortunate to present with Emily O'Connor from Lydia Place, who's delightful. And we were able to just share a lot about kind of the social determinants of health regarding homelessness, houselessness, and what that does to our patients. Nobody who works in healthcare can ignore the social determinants of health or deny the impacts that these have on our patients. But so frequently we don't have the time or resources to be able to help. So this series was great as it presented solid advice and suggestions on how to advocate for our patients in everyday situations, and then also hold our sister employer, Peacehealth, accountable for being more social justice and having that health equity lens in all aspects. I mean, I think it's important to acknowledge that we are all working within these broken systems that we don't have much control over, and opening the dialogue between these systems to break down the barriers that exist for our patients and other oppressed members of our community is a great place to start. And then why do I have a nonprofit? Like, being a nurse and a mom wasn't enough, right? It's my favorite question. But I'm a nurse certified in case management. So I think my lens of social justice and social determinants of health is much larger than maybe your average nurse. And I was in a place in the emergency room in a new role as a nurse care manager, where the emergency nurses would just save everybody overnight for me to come in the morning with my magic wand. And you get housing, and you get housing, and I have this for you. And I didn't have any of that. So I really looked within my community and really tried to figure out what the gaps were. Why didn't I have these resources? Where were they? What was missing? So I started attending city council meetings. I started attending county council meetings. I attended what used to be the homeless strategies work group meetings, the housing advisory council meetings, any meetings I could around housing to figure out what were the gaps and what was really needed. And all I kept hearing was, we need more service providers. We need more service providers. We need more case managers. And I am a case manager. So how do I make that happen? And how do I become a service provider? And so just kind of by default, through volunteering and other things, I realized we just needed more. And so that's how Road to Home was formed. I also have great people on my team. It's not just me. I just want to throw that out there. But in order to figure out what needed to be done, I had to do research. And this is what most people don't have time to do. So I was really fortunate in that aspect. And then to just bring that back to the community where I work, was really interesting in this series. I noticed from Road to Home and all my volunteer work, most people volunteer in silo. What I'm interested in is not going to be the same thing as my friend. My friend might want to save the salmon, they want to do this, they want to do that. And so people don't normally volunteer together. And so to have all of these opportunities presented to the organization, to their employees, where it was very easy for them to plug in, was very impactful. So for example, Road to Home, what Peacehealth and their caregivers were able to do is they, even though they're on the front lines of fighting this pandemic, they got together as units and made welcome baskets for our residents. And we were so overwhelmed by the involvement of that community from Peacehealth. We got over 50 welcome baskets for our residents, so much so I had to build more storage to keep them till we have more residents. But the outpouring of love and generosity was so felt by us and our residents. And then additionally, we hosted a painting party that was easy for people to plug in. And so few people came for that who are now long-term volunteers with our organization. And I hope that's happened in other organizations who participated in this. But just having that place where people can plug in and utilize the knowledge they already have from being healthcare providers into throwing that into the community and then making our community a better place is really powerful and speaks to the impact of this program.
That's great. Thank you, Melissa. Thank you so much for being here today. She's very busy and may leave us shortly in a moment. Just to wrap up, all of our caregivers who participated in this 6-part session, including our community members who joined us for this learning, now have a pin that says Health Equity Advocate. We're going to be distributing those in December. I think that's really important, that especially as patients see them, they not only see their employee badge, but they see this pin and can recognize that that's that extra work, that extra learning that they've done to stay involved and engaged. And something really special to top it off, every employee who finished the session was given $100 that we are investing in their name into a local nonprofit of their choice. We really hope that this not only help them deepen their understanding about the organization they selected to invest in, but also maybe they will choose now to invest on their own, whether that's their time or their money or their resources as an individual. So we're delighted about this. The council is already planning the 2.0 for next year, and they have new sessions they're planning to add on to the 6 that were already presented. And I'll say that the last thing we did was session 6, which you didn't see up here, was 100% just a dialogue. We invited people who went to the first 5 to join us and to share what have they put into practice. And we heard just some incredible stories, and that's also where we got the ideas for the next sessions for the upcoming series. Thanks for having us today, Monty.
Yeah, thank you, Rachel and Melissa, the amazing work. As you can see in the chat, much appreciation is coming your way for kind of offering that up. And love, again, this idea of how intentional you all are being around building the capacity and pathways for folks to feel like they belong and to be able to contribute. So very cool example. We have another one. Marco, if you're up, if you wouldn't mind sharing a little bit about Mount Vernon.
Sure, thanks so much. And thank you, Tatiana, Rachel, Melissa, that was awesome. I've heard about some of the work already, so it's really cool kind of to learn about the context in terms of like the way that it happened. So that's really neat. I'm gonna share my screen with you all to kind of talk about a project that we're starting here at the North Sound ACH. My name is Marco Morales. I'm a project manager here, and it's around language. It's a language access project that we're kind of getting going. And so let me begin by talking about sort of how this project. There we go. So yeah, providing some context around also how this project came about. So I've been at the ACH for just about 3 months. I came on in August, and prior to that, I used to work at the Mount Vernon School District. And early on when I came to the ACH, I was asked to review a survey that was given to our partners around language access. And I think just kind of the big takeaway from the survey was that our partners felt like that Spanish, Russian, Vietnamese which were the more common languages, they feel like they had a pretty good grasp of the way that they were able to provide services in terms of, being able to find translators and interpreters. But when it came to indigenous Mexican languages or other indigenous languages from Latin America, a lot of our partners feel like they didn't have the resources to be able to provide those languages. Folks would come in that would speak Mixteco or Triqui or Mam, languages from Southern Mexico or Central America. And a lot of our partners feel like they didn't have the translators to provide those services. And so one of the things that we noticed was that the languages that were requested when folks didn't speak English or English was their second language was that 94% of the time, it was Spanish, 64% of the time was Russian, and then Vietnamese was 24%. And so sort of from this question, my colleague Alicia, who used to be at the ACH, was like, so she had me read the survey. It was like about 25 pages, and then she said to me, well, how do we fix this? And so I kind of chuckled, and I thought about the students that I work with when I used to be at Mount Vernon schools. So I used to work with both middle school students and also high school students. And a lot of my students were trilingual. They spoke English, Spanish, and Mixteco or English, Spanish, and Triqui. Some of the indigenous languages where folks in our North Sound region were not able to provide adequate services in those languages. So, I said to my colleague, I was like, what if we train the students or provided training for the students so they could become the translators, that our community needs? And what if we work with the schools to help them get the training so they can, fill those roles, and they also can, work towards their graduation and also work towards like a living wage job, right? And so that was kind of how this came about, how this whole idea came about. And so I approached my colleagues at the Mount Vernon School District that I used to work with the idea about, kind of putting this together, and they were really excited about doing that. And so just to kind of give you some context there around that. And so I think, sort of the goal is to have at least 25 students starting in fall of 2022 that would be taking this class on on how to gain the necessary skills to be able to be translators. Most of these students already have the language skills, but it's more about like what are the soft skills that come in addition to speaking the language, right? And so the schools have agreed to use their own Mixteco translator that they have there at the Mount Vernon School District to be the person that teaches the course. And so they have one at the district, and they talked about having him teach the course. And then so that would be in fall of 2022. It would, kind of takes a while for them to be able to kind of put a course together, but we're looking at September of next year. And then we're also working on another project with Whatcom Community College that is actually more than likely going to happen quicker. And they already have a class at Whatcom, and this will start in spring quarter, which is in April of 2022. And it's going to be a course that will be paid for by, the tuition will be paid for by the North Sound ACH. We're looking at paying the tuition for these 12 students that are attending Whatcom Community College to be able to be the folks that we need in some of these healthcare facilities. And then I reached out to some colleagues at Skagit Valley College, and sort of like, it's interesting how the universe works sometimes, but they just started a bachelor's in healthcare management at Skagit Valley College, also in Mount Vernon, for folks that are maybe outside of the North Sound region. So this is sort of kind of happening simultaneously. So when I talked to them, they were interested in also trying to figure out a pipeline from the high school into their BA program at SVC in Mount Vernon, which Mount Vernon schools and Skagit Valley College are in the same town, for folks that don't know. And so when I was in some of the discussions that we've had with the high school, and having worked at the school district, I know the students have to have a graduation pathway. It's a sort of a system that keeps track of them to make sure that they graduate. So this was kind of fitting because students have something to kind of look forward to post graduation. And so we kind of came up with the sort of a list of things or goals for students around like, what this would mean for them. And so, I think, so before I kind of go over the sort of the goals, if folks want to read them, the other piece to this is finding partners that are healthcare providers to be able to offer the students internships. So what would happen would be that the students would take the classes either at either at Mount Vernon schools or at Civic College, or then at Whatcom Community College, and then towards the end of their like educational journey, they would be offered an internship with a partner organization. And then we're currently looking at partner orgs that would be interested in hosting students as interns. And so some of the goals for the students, would be some of the goals would be for them to be able to increase their networking skills, right? When they, it'd be much easier for them to get a job in some of these places if they're already interned there, right? It would also provide them with soft skills in the workplace, and also would increase their self-esteem. And I think this is a really key piece, because I think Tatiana, you mentioned this earlier. I read it when you were talking about this question of belonging. A lot of times folks who speak English as a second or third language, as you mentioned, there is this kind of piece of not feeling like you belong, right? And then for people that are, that speak indigenous languages or indigenous, colonization has done a really good job of making us not speak our language. My grandfather spoke Purepecha, my parents don't, and neither do I. And so, some of these kids are constantly, some of these are constantly told that they're, to forget their indigenous language because it's not useful. Right. And so I think this whole process of telling them that, of having students see the use in how their language is a powerful tool for, to do the colonial work, and also to be able to provide access and service not only to themselves but to their community members, I think is really powerful. And it also allows the youth to be able to see their languages, whether that be their indigenous language or Spanish or other languages, as an asset rather than a liability. And so that's sort of some of the goals for the students. And I'll show, I don't know what happened to my screen. Oh, there we go. So maybe, sorry, I think it just oh, there we go. Yeah, so okay, so we'll just go to the slide. I think I skipped the slide. But yeah, some of the goals for the schools and the colleges are, I think the schools in some ways also benefit because they provide options for students towards graduation, and then schools also have what they call a high school and beyond plan, where their schools are required to show how they're working with students towards planning after high school. In terms of what the benefit to Skagit Valley College, it would also benefit their enrollment numbers. Colleges are also, they're mostly funded in terms of how many students that they have, right? And so having them the ability, giving them the ability to increase the number of students that they can enroll is also beneficial to them. And Skagit Valley as a college is currently working towards becoming a Hispanic serving institution. And it's close in terms of the percentage of students that they need that identified as Latino or Hispanic, but they're currently not there. And then they're also able to offer coursework that positively impacts the community at large. I think community colleges, I would make the argument community colleges, even more the universities, were really built around given access to community members. And the non-traditional student versus the university, which is more created around the 18 to 22-year-old more common student. And then it also gives the colleges an opportunity to provide access and to serve underrepresented populations and lead towards racial equity efforts. And then I'll talk about, sorry, my thing keeps changing on me. Okay, and then so we'll talk about a little bit about the goals for healthcare and host partners. I think it will give our partners an opportunity to be able to really, increase capacity to accurately provide services. I often think about the folks that they go to a clinic and they don't really know what is going on when they're, when they have to receive services, and how terrible that is for both especially for the client, but also for for the folks that are working there, when they're not able to communicate with the person that's receiving services. And it also will provide an opportunity to work with community members, both interns and clients in a setting where their language skills are valued. I think often when folks go to these places, they don't feel like, if they're able to gain services in their language, then I think they see that they're valued as clients. But if they're are not able to be served in their language, then I think they often think that, how much does this place really value me as a patient or a client? So I think this is a really a key piece, and it also will be able to provide an increase in internal and external cultural capital, and I think that that cultural capital piece is really important, because I think that leads to more trust in the community, when you have that sort of capital around being valued as a patient and a client, and I think that's really where this piece of community trust grows, and then I think it will also increase the networks in BIPOC communities in the area, in BIPOC communities in the area. Okay. And I think with that, that's pretty much my presentation. I guess I'll talk a little bit about sort of where we see this going. Just maybe in the last 2 or 3 minutes. I think a lot of this is kind of in the works right now around figuring out how to kind of implement this. But, I think ideally it would be something that we'd want to see in other places as well, around the state, possibly around the country, because I think the work of including communities and giving language access is so key to be able to receive adequate services. But that's my presentation, and I look forward to hearing questions, or maybe how folks can be involved or partner with us. Thanks so much.
Yeah. Thank you, Marco. It's just an amazing living story that you have there, and I love how you talked about really flipping the switch and reclaiming this cultural asset, and just how it snowballed into all these incredible co-benefits. So amazing story. So Heather McGinnis, I'm going to pass it over to you, because I think you're going to help lead us in a little bit of dialogue.
Yes, thank you, Monty. And thank you so much to each of our presenters for sharing with us today. It was really wonderful to learn more about the work that you're doing and how it helps to advance belonging and civic muscle in our communities. So we're going to have a bit of a panel discussion where I just have a couple of questions for each of you. So I know, Rachel, that Melissa had to jump off, but we would love to have Tatiana and Rachel and Marco and also Nicole join us for a little panel. And if you have questions for them, I think we're gonna hopefully have some time at the end to do a few questions. So in the chat, if you want to pop those in as we're going, that would be great. Questions or comments for the group, that's great. All right, so thanks everybody. This is really a great session today. And so the question I want to pose to each of you, and we can just kind of go around and each of you speak to it in whatever way you would like. After hearing about all the work that we're doing and thinking about belonging in civic muscle, what can we do both as individual organizations and as a regional collaborative action network, what the ACH work is moving towards? What can we do to advance belonging in civic muscle, both in the short term and the long term? What's coming to mind for you? Maybe we can start with Nicole. Do you have any ideas? And then we'll pass it off to other presenters.
I think what comes to my mind first is just continue co-creating and conversations with the community and community partners who are sort of at our trusted are doing the work and really understanding what are the needs. And, Marco shared a bit about the Language Access Project, and it really started with a few small conversations with like, we're feeling this need from providers and they're expressing like what was going on, and really, I think having an open ear for, oh, that kind of sounds like belonging, or that sounds like, thinking outside of the box a little bit, which comes to mind with a lot of like with COVID and things that are going on right now, is like, it's not the way going back to normal for a lot of this stuff's wasn't working before. And so I think a lot of like the community input around what we've been kind of hearing from, it starts with those who are on the ground. And so I think being really open to that is important.
Awesome. Thanks, Nicole. Marco?
Yeah, I think I remember, so when I first started, and my colleague Vanessa's on here right now, I remember having conversation with her around women having to give birth and not really knowing what was happening. That just resonated with me, because even, as a kid, I remember having to translate for my folks when I would go to when they would go to the doctor. Right. And I think, this was maybe like 20 years ago. And I think a lot of those same questions are those same questions, those same issues are still present 20 years later. Right. And so, unfortunately, I think our healthcare system needs to do more around being able to provide dignified services. And often we have the resources in our communities, but we just don't know how to tap those resources, right? Here we have, we have, all these patients that are going to receive care, and they don't have anyone that speaks Mixteco, but then we have like thousands of people that speak Mixtecos in Skagit Valley, right? And so, but then, we run into all these things around like how to provide access, but it doesn't seem like it doesn't seem sometimes like we ask the right questions. But I think aside from asking the right questions, I also think that that one of the things that we need to do a better job is that looking at people as assets instead of looking at them as liabilities, right? Because I think people really do have those skills, sometimes that we don't. But how do we provide them the opportunities to be able to flourish and to give us the opportunity to provide better services?
Thank you, Marco. I can jump in with complementary thoughts. Yeah, I think when I was talking, I was mentioning some questions that I think can be part of the internal conversation to really understand what we think and how are we treating the people beyond the smiles and kindness, but how effectively we are treating the people that we serve. And so that's some reflection, again, at the organization or institutional level, but also asking them, like, find ways to connect with people on the ground and say, how do you feel with us? Not necessarily, because there's a lot of surveys or regarding the quality of our service. That's not necessarily what this conversation can be about. Like, how do you feel? Do you feel respected? How can we do our work better so you feel that you belong to, not just with our organization, but in the community? So really, that's the moment, like I think Nicole was saying, like, how can we really listen and be really open? So I think that work in both levels needs to happen. Yeah, I think I had another idea, but it will come back later. Thanks.
I want to, Nicole, I think I want to connect, and Heather, something that I heard both Melissa talk about, and then Leslie has been really chatty in the chat window if you've been following some of her great comments around really paying attention to what's happening in the different sectors. And when Melissa was here, she was saying, how important it is we get out of our systems. She described the experience of being a case manager working in the emergency department and realizing she needed to start going to county and city council meetings and advisory board meetings and really paying attention to what was happening in the public sector and how things were being funded. And I think the same is true for our organizational leadership. I spend probably a good 10, 20% of my time just monitoring how those conversations are happening in the political space. It really is very much a political activity to track and see how we're making both local and state and even federal investments. So that's one thing I would say is just, the more we can get involved in community in that way, and really stretching our civic muscle. It's not always comfortable to be in those spaces, as all of you know, but that advocacy work is essential, especially for our organizations that are trusted organizations in the business or nonprofit sector, to really step forward and advocate on the behalf of the needs of community.
Absolutely. Thank you, Rachel. Great. Well, one other question I wanted to ask as well is, how can North Sound ACH play a role in expanding and fostering belonging and civic muscle in a way that individual partner organizations might not be able to?
Is this for me or Nicole?
Oh, for anyone, really.
We're both from the North Side ACH. Okay, that's cool. So I think this project is I think is so I get so excited about this project because I think it could be really impactful around the work that organizations that are not the ACH do, right? Because I think in some ways we're just kind of setting the platform, right? Because the partners are really going to be the ones that are going to be doing a lot of this work, and we'll have direct impact with the communities that each partner is serving, right? So if you're if let's say you're a hospital and all of a sudden you have, let's say, 10 interns that you're multilingual and you have never been able to provide services in this language. How is that going to impact your the services that you're providing now, right? If you're a school that is offering these courses that you've never been able to offer, what is that going to do to your school? And also not just like the short-term impact, but also what that's going to the bigger things that's going to lead into, right? And so I get really excited about this whole project because I think as it continues to grow, I think it will lead to other avenues, and some of the organizations that are a part of it can really start thinking about aside from because I think my colleague Rocio and I have been kind of thinking about this, and as we've had these conversations, but I think this is really the tip of the iceberg, right? Because I think when you get these interns and these students to come into your organization, the translating and sort of like the interpretation piece is really just sort of the beginning, right? Because now you can potentially have folks that are doing other things that are outside of translating, right? So I talked about this idea of getting the students to be able to get a bachelor's in healthcare management at Skagit Valley College, right? So now you have students that have all this cultural capital, language capital, and now they have a bachelor's in healthcare management that are being trained at your local organization. And what does that look like in 10 years when they've also been, have gotten some of the work experience by working with you where you're at, right? So I think it really provides sort of the basis for creating things that are much bigger that we don't really even see at this time yet.
Thank you, Marco.
I think a couple of things that come to me is, one is, I think, connecting with Marco's comment is like a role modeling. That's one. And the other one is investment. Because investments is the way how things are going to start shifting, going beyond the talk, but really how much are we investing in that, in meaningful, not just engagement, but listening and doing what we hear, from the requests from the different communities. I think those two.
I just want to tag on to that what Tatiana said around investments, and I think seeding really seeding important work that might not be invested in by traditional funders, because they want to see like things like a 10-year track record or evidence of other successful projects. And I could go on and on and on. But how do we see those startups that are absolutely essential and are community powered? And that's what we've been really excited to see some of North Sound's work the last several years. I think that's a role model for other community partners.
Thank you, Rachel.
No, and
Nicole?
I think for me, it's, and Rachel mentioned this too, it is sort of well, there's two things. Tatiana mentioned it too, like being a role model. So trying to step into the discomfort of what it means to make true change. So, and for me, that kind of connects to like, we have to either collectively as a network of organizations feel the tension of injustices that have happened, since first contact for the tribes of our region, and then things that have followed since then, and the ongoing injustices that are occurring in the different health systems. And I think Rachel nailed it, where it's like, we got to think outside of the systems, but we also have to work together to help support change the different systems. And so I think for me, it's just like holding space of like collectively at a network, what would that look like if we could help with role modeling, or how do we do this work of feeling that discomfort collectively, but then acting upon it? Language is so important. And I think we're seeing that so much with COVID. And but it's always been there. The story that Marco was sharing, that was before pre-pandemic, and still happening, of pregnant women going to give birth and not having an interpreter in the room helping. And there's other topics that I think we, the ACH, have collected following webinars around. We had a Two-Spirit LGBTQ training just to really understand the barriers in the region, around health services for those communities, reproductive health barriers, just things that have been there for quite some time. And so as a collective, what is it that we are ready to tackle together? And I think that's kind of what speaks to me a little bit of like, it's up to the partners to decide that, but it's also, we could hold space for that. So it's kind of coming up for me, and, and thinking of all the different topics, housing, food security, recovery, those types of things. So that's what's working in my brain right now.
Thanks, Nicole. Well, I want to make sure we have enough time for some discussion and questions at the end. And so I am going to pass it over to Monty now to talk about that and close us out. Thank you.
Yeah, thank you. I'm just monitoring the chat and just going to call out Leslie Brown, who just has been all the way through, really offering a lot of great insights and affirmation. So if you want to add anything and bring your voice into, I open that up for you, Leslie, because I know I'm probably not alone in appreciating a lot of your comments, but many others too. And I think Stephen may have had his hand up earlier on. I don't know, Stephen, if you're still there, if you wanted to make a comment, please.
It's more of a question. My name is Steve Jung. I'm a member of the board of the Orcas Community Resource Center. And we're making slow headway. But the initiative now sort of sits with a board that's pretty traditional. If you look at me, you'll see I'm old and white and wearing a university t-shirt of all things. And what I take from it is, from what I've heard here today, which I've loved, is in order to make really meaningful progress, we need to be able to listen. And a key element of respectful interaction is being free from unconscious bias and implied belittlement. And that requires intensive self-awareness and introspection. And I'm just wondering whether anybody has assets that they can bring to the table to help people like me do meaningful self-examination about the unconscious biases toward any kind of differences that I bring to the table when I'm blunderingly trying to be of assistance.
Stephen, thank you so much for that question and comment. I'm going to encourage folks, if you have some ideas or resources, feel free to chat those out. I know there's a lot of people that probably could answer that question. Tatiana, since we don't have a lot of time with you, you kind of brought this up in your very first piece. I don't know if there's anything that you want to maybe speak into on that front.
Yeah, Stephen, thank you so much for your question. It's so important because I think that it doesn't impact you only as a white male, like you self-identify, it's for all of us. And I think some of the work that some organizations in the country are doing is to really have more trainings in cultural humility and cultural reverence and those kind of things, because that's something that helps to start the journey. Because and also understanding that one of the principles of cultural humility is that this is a lifelong journey. It's not like a training. It's gonna kind of shift things that we've been internalizing for forever. And we keep internalizing everywhere. So it's really a long process. But I think these conversations and additional trainings perhaps can really help when our organization is committed to it, start shifting the process. How are we talking to each other? How are we treating to each other? So we cannot really train everyone in cultural humility or languages. It's more like at the human level. How am I seeing the other human being that is in the room, and how I'm recognizing him or her with respect and honoring who he is or what he brings to this space. So it's a long journey, but it's an intentional journey, almost a daily journey that needs to happen. And again, these conversations I think are essential to bring that to our constant awareness.
Yeah, thank you for that. And again, thanks Leslie for putting in a resource. And Stephen, I think your question is so big and so central that, it's something that I think the North Sound ACH will continue to be thinking about as we move into this journey together. So again, just kind of looking at the clock, I want to just, again, thank all of the presenters for sharing their stories and kind of really helping us breathe some meaning into this idea of belonging and civic muscle and helping us to really reframe it in a lot of ways. I love, the quote in there around really not thinking about this as a charity, but really from a justice mindset. Why do we have hunger? Instead of how do we feed the hungry is an important one. I think that many of the stories we've heard are really when we start to reframe these and we start to see the value and people and the dignity and the capability and really support that, we see extraordinary things happening. And I think it's exciting to continue to imagine what that looks like for the North Sound ACH. In fact, I would suggest that the success of North Sound ACH really depends on this. Everything we could do could be building belonging, could be building our civic muscle, and that's probably the only way to be thinking about this work. So I want to thank you all for being here. I want to just, again, acknowledge the space that we're in right now, that this is a really time of great adversity for many of you in your community. And